This morning on the Morning Blend, we are joined by Dr. Lisa Thiel, who is with Corewell Health, which is in Grand Rapids, but you guys are coming to Lansing. Good morning.
Good morning.
So tell me a little bit about Corewell Health and why you're coming to Lansing.
That's a great question. So we have now Corewell has incorporated our Beaumont hospitals and our Grand Rapids hospitals and all the subspecialty groups in between that, and that includes DeVos Children's Hospital. And so as we work closely together to provide services around the state, we see patients from the UP down to Northern Indiana, but we also want to make sure that patients aren't having to drive quite so far to seek our services. And so we really want to make sure that we're supporting the obstetric community in Lansing.
Talk about the specific services that you're going to be offering.
Yeah, there are 14 different pediatric subspecialties, and one of which is included adult congenital heart, and the other is maternal fetal medicine. So we are kind of the backbone that set up anything that's diagnosed in utero for a pregnancy to help with using ultrasound and diagnostic techniques to help with a diagnosis, help with a delivery plan, to help with the obstetric delivering groups that are going to be helping with that delivery, to make sure that we're trying to provide as much advanced level obstetric and maternal health care as we possibly can. If there are some patients that need to deliver with us downtown in Grand Rapids for any intervention with the DeVos pediatric groups after delivery, or if there's a significant maternal surgery that we need to be a part of as the maternal fetal medicine specialist, then we will make that transition to our hospital really smooth and make sure that we're doing as much as we can in the Lansing area so patients aren't having to drive as much.
So you get that multi-specialist team right here in Lansing. That's kind of cool. That's important, isn't it?
It's really important. And patients, especially when they're pregnant and they have a lot of appointments with their OB locally, it's really hard sometimes to take an entire day off of work to come out to the Grand Rapids area for a consult or for the ultrasound. So we're bringing those services to them.
Making it more convenient for everyone, really.
So the clinic itself is set up beautifully. It's brand new. It has these beautiful rooms that allow lots of space for anyone that's differently abled, or to make sure that they're going from one room to right across the hall to the next room for their consults, to decrease that wait time so that their appointments are very efficient. And then we also have great communication with anyone that's referred their patients to us so that they get a full plan of what our guidelines or recommendations might be. And I also I'm really excited because I did my residency training right there at McLaren, an affiliate of MSU. And so it's come full circle.
Dr. Lisa Thiel.